HSR is a geohealth company that merges, publishes, and analyzes data on social determinants of health, along with health outcomes and costs, ultimately providing point-of-care decision support at multiple geographic levels. For the OGC Disaster Resilience Pilot, HSR's philosophy of providing health-related insights at the point of care is being leveraged to identify and geocode actionable healthcare data to support the emergency response planning effort. According to the United Nations, financial damages and the cost in human lives due to natural disasters are tremendous. These statistics predate Hurricane Maria and other large-scale disasters. In the response to Hurricane Maria, there is anecdotal evidence that the lack of medical personnel early on in the response contributed to storm-related fatalities. These are lives that could have been saved if medical personnel were dispatched to the disaster-impacted area sooner. The scope of the need for medical personnel wasn't known until the response was underway. HSR's system provides the foresight to ensure the medical and health needs of the impacted population are known in advance and can be addressed. To do so, a health SDI is being built, bringing together relevant health and social data identifying a population's risk of adverse health events due to a natural disaster. This is produced as a health risk index. For the social data, we are leveraging the CDC's Social Vulnerability Index in part. The purpose of the SVI is more broad than supporting disaster response, and we extract data that best addresses this more narrow situational use case. The health data includes data on conditions that may flare up due to disasters or are susceptible to degradation after just one or two missed medication doses or treatments. Such disruptions are common in disaster scenarios. As natural disasters take place anywhere on the globe, the health risk index can be scaled up or down to any level, starting at the global level, from the global to the national level, and to the subnational level, shown here at the zip code level for the United States. Storm tracks can be overlaid on the health risk index to allow emergency operations managers to quickly identify populations that most urgently need emergency services. For the on-the-ground emergency medical responders, more specific details are provided on the local health posture that inform their delivery of medical services, such as literacy levels, mental health, and critical conditions, at the county level, as well as at the zip code level, as shown here for Tropical Storm Gordon. In addition, leveraging the National Address Database, address data for individuals with critical conditions can be provided, along with lat-long and possibly landmark information that can be helpful in locating addresses in the midst of a disaster. The symbology, as well as the legend for the Health Risk Index, has been adopted from the National Alliance for Public Safety GIS Foundation. The legend is a 7-point scale ranging from very low risk, or a white color on the map, to an extremely high risk, or purple. The greater the risk, the more urgent the need to provide appropriate medical care and intervention to the population within the geographic region. The Health Risk Index is publicly available on an OGC Open Standards-based Health SDI. The index has been shared with Esri and CompuSalt through WMS for potential inclusion in their platforms, allowing for wide use of the information by the first responder community. The index is also available in the health community on geoplatform.gov, along with additional related data sources through the High Field Data Catalog, such as emergency services and public health information from the Veterans Health Administration. The next steps are to formalize the data sharing policy and procedure agreements with all data providers, as well as continue to determine optimal data sets and sources for inclusion in the Health Risk Index, especially at the global level. Field tests to fine-tune the Health Risk Index are planned for later phases of this effort, which will be an opportunity to ensure the index conforms to FEMA's planning and execution workflow. There is interest in leveraging the index to support and track post-disaster recovery efforts, as well as the continued development of the health community on geoplatform.gov. HSR would like to give special thanks to the organizations that made this work possible. Thank you.